student nurse Rosalinda Ondoy. So today I will be performing inserting of nasogastric tube. So insertion of nasogastric tube permits the patient to receive nutrition through a tube feeding using the stomach as a natural reservoir for food. Another purpose of an NG tube may be to decompress or to drain unwanted fluid and air from the stomach. So the first procedure is verify the medical order for insertion of an NG tube. We need to verify the order so that we will insert NG tube to the right patient. So I've already verified it. And then perform hand hygiene and put on PPE if indicated. This is to deter the spread of the microorganisms. And then next, identify the patient so that you will give nursing intervention to the right patient. Today, ma'am, I ask your name po. Thank you, Ms. Reyes. And then explain the procedure to the patient and explain the rationale why the tube is needed. Discuss the associated discomforts that may be experienced and possible interventions that may allay this discomfort. Answer any questions as needed. So, today ulit ma'am, today po, mag-i-insert po ako ng NG tube sa inyo since hindi po kayo naka-swallow. So, this procedure may hurt you or may give you uncomfortable feelings since this is an invasive procedure. Pero rest assured po ma'am na hindi naman po serious yung pain. And then if you have any clarifications and questions, don't hesitate po to ask me. And then, gather all the equipment and select the appropriate NG tube. So, here I've already gathered my equipment. Close the patient's bedside curtain or door. Raise bed to a comfortable working position as usually elbow height of the caregiver. Assist the patient to a high crawler position to elevate the head of the bed to 45 degrees if the patient is unable to maintain an upright position. So, assisting po, ma'am. Ito ng puno. 1, 2, 3. Ito po, ma'am. And then, drape the chest with bath towel or disposable pad and then have anesthes basin and tissue handy. And then put on gloves. By putting the gloves, you can protect both you and your patient from each other. And then measure the distance to insert the tube by placing the tip of the tube at the patient's nostril and extending to the tip of air lobe and then the tip to the tip of xiphoid process. And then mark the tube with a marker. And after that, lubricate the tip at least 2 to 4 inches with water-soluble lubricant. This is to make sure that the tube will slide in easily. I've already lubricated it. And then apply topical anesthesia to nostrils and oropharynx as appropriate. After selecting the appropriate nostrils, which I already did, ask the patient to slightly flex head back against the pillow. Ma'am, can we flex your head back against the pillow po? Thank you. This is for easy insertion of the NG tube. And then gently insert the tube into the nostrils while directing the tube upward and backward along the floor of the nose. Ma'am, insert po ako ma'am ha. Thank you. And then, patient may gag. Patient may gag when the tube reaches the pharynx. So, provide tissue for tearing or watering of the eyes. And then offer comfort and reassurance to the patient. Ma'am, meron po tayong tissue pag naiiyak po kayo. You can use that. And then when pharynx is reached, instruct the patient to touch the chin and chest. To touch the chest with the use of the chin. So ma'am, pwede po ba kayong yumuko kung maabot niyo po yung chest niyo? Okay, thank you po. Ma'am, encourage the patient to swallow even if no fluids are permitted. So ma'am, kahit po walang fluids akong ibigay sa inyo, pwede po bang mag-swallow po kayo? Sige po. 1, 2, 3, swallow ma'am. Swallow po. Okay po. Thank you. And then stop when patient breathes. If gagging and coughing persists, stop advancing the tube and check for placement of the tube with the thumb, blade, and flashlight. If tube is curved or straighten it and attempt to advance it again. And then keep advancing the tube until the marking is reached. So we have here our marking. Sige ma'am, swallow lang po. And then do not use force and rotate tube if meets the resistance. Discontinue procedure and remove the tube if there are signs of distress such as gasping, coughing, cyanosis, and inability to speak or hunt. Secure the tube loosely to the nose or cheek until it is determined that the tube is in the patient's stomach. Loosely. And then after that, attach the syringe to the end of the tube and aspirate a small amount of stomach content. This is to check the pH level of the content. And then make sure the pH aspirated fluid using pH paper or meter. Place a drop of gastric secretion onto the pH paper or place a small amount in plastic cup and dip the pH paper into it. Okay, I'll drop na po. Within 30 seconds, compare the color in the paper with the chart supplied by the manufacturer. Okay, we have obtained 3, which is a good indication. And then, attach the aseptic syringe to the NG tube. And then after that, visualize the aspirated content, checking for color and consistency. So if we aspirated greenish color, then it is a good indication that it is placed correctly in the stomach. And then, obtain radiography, X-ray, of the placement of the tube based on the facility policy and ordered by the physician. And then remove gloves. Remove gloves. Remove gloves and secure tube with a commercially prepared device. Follow manufacturers or tape the patient's nose. Open another glove and clamp the tube and remove the syringe, cap the tube or attach tube to suction. And then, after that, measure the length of the exposed tube, reinforcing the marking on the tube at the nostrils with indelible ink. Ask the patient to turn to the head to the opposite side opposite of the nostril in which the tube is inserted. So, ma'am, turn to the side. And then, secure the tube to the patient's gown by using a rubber band or a tape or a safety pin. Secured. And then, for additional support, tube can be taped onto patient's cheek using a piece of tape. And then next, assist with or provide an oral hygiene at 2 to 4 hours intervals. Lubricate the lips generously and clean ears and lubricate as needed. Offer analgesic throat or anesthetic spray for the throat irritation if needed. And then, remove equipment and return it to the patient's position of comfort. Remove gloves. So, ma'am, pwede ko na po ang tissue. And then, after that, remove gloves and raise sides of the rails in lower back. Then, remove additional PPE if used and then perform hand hygiene. And then, document all necessary data for future purposes. That would be all for inserting of nasogastric tube.